Many employees in many different industries work with hazardous chemicals. Many of these chemicals can cause injury or death if workers don't take the right precautions. It's important to understand the chemical hazards in your workplace, how to obtain information on those chemicals, and what to do if a spill or accident occurs. Upon completion of this deck, you should be able to recognize the purpose and requirements of a hazard communication or HAZCOM program and identify chemical hazards and their controls in your workplace. You should also be able to identify sources of and requirements for medical record. Included in this course, we will discuss hazard classification, HAZCOM program, labeling system, safety data sheets, SDSs, carbon monoxide, fuel SDS, identify the hazard, employee information and training. Chemical exposure can lead to a variety of illnesses and injuries, ranging from burns and rashes to nervous system damage, organ damage, and cancer. Some chemicals can produce flammable or explosive vapors that are colorless and odorless, meaning that you might not know they're there until it's too late. Some chemicals also produce toxic vapors that can be colorless and odorless. Exposed workers can experience both immediate and delayed health reactions to chemical exposure. Some chemical reactions might not be noticeable for months or even years after exposure. Finally, some chemicals can react violently with other chemicals, creating additional hazards and making existing chemicals even more dangerous. Precision is required to develop a hazard communication or HAZCOM plan. This plan is informally referred to as the employee's right to understand a good HAZCOM program, ensures that chemical hazards in the workplace are evaluated and that information regarding these potential hazards is provided to employees. The purpose is to keep you informed about current and future chemical hazards and to give you information and other means to protect yourself. HAZCOM plans don't prevent you from being exposed to hazardous chemicals. However, they can give you and your coworkers knowledge, training, and equipment to help you work safely around the chemicals in your work. As part of our HAZCOM plan, we must identify and document all the chemicals that you work with and what proper protective measures are necessary for every chemical in our workplace. We must include label and warning information safety training requirements and where you can access all safety data sheets known as SDSs. You'll find there are many labeling systems used throughout your workplace, but this deck will mainly cover the Globally Harmonized System, or GHS. This system is used on manufactured containers that are shipped to our workplace. And these are explained later in this course. Precision is responsible for training you on our custom labeling systems, in addition to a chemical inventory and all safety information we have available. The HAZCOM program should also include employee training that is meant to familiarize you with OSHA's HAZCOM standard and its requirements. You should also receive specific training that provides clear information about the chemicals you'll use for your job duty. Finally, we must provide employees with personal protective equipment. It's up to you to follow the plan and training while you're working. You are responsible for wearing any necessary personal protective equipment or PPE and inspecting it before each use. You'll also need to be familiar with all chemical hazards in your workplace, know your facility's emergency procedures, report injuries or spills immediately, and ask questions if you're not clear about a chemical's hazards or safety procedure. You are responsible for any of your job duties and must make sure that you know exactly which chemicals you're working with or around and how to protect yourself. An SDS must be available for each hazardous chemical in your workplace, and those SDSs must be kept in a location where you and your coworkers can access them as needed. If an SDS is lost or didn't arrive at your facility with the chemical, your employer will need to obtain additional copies by contacting the manufacturer, importer, or supplier of the chemical. Compliant labels supplied by the chemical manufacturer or distributor must appear on every original container of hazardous chemicals. The label must display one or more of 9 pictograms to help workers identify that chemical's hazards. Labels must also show a signal word, either danger or warning, that indicates the relative severity of the hazard. Danger indicates a more immediate or extreme hazard than warning does. Labels must also have a hazard statement which describes the nature of the chemical and a precautionary statement which describes the recommended precautions to minimize the effects of exposure to that chemical. The label must also have a product identifier which tells the chemical identity of the substance. Finally, GHS compliant supplier labels must list the supplier's information, including its name, address, and telephone. Make sure that you can read and understand the GHS label before you're working near any. SDSS will also contain exposure limits such as threshold limit values, permissible exposure limits, and any other exposure limits recommended by the chemical manufacturer or importer. SDSS should be reviewed by each person that handles, stores, or disposes of the chemical. Keep in mind that one SDS may apply to multiple complex mixtures having similar contents and hazards. For more detailed information about the hazards of any chemical, you can consult its safety data sheet or SDS. Carbon monoxide poisoning occurs when CO builds up in the bloodstream, replacing oxygen in red blood cells. The symptoms can vary based on the level and duration of exposure, and they may resemble those of other illnesses, making it challenging to diagnose. Here are the key symptoms associated with CO exposure. 1. Mild exposure, headache, often the first symptom noticed, nausea, feeling sick to the stomach, shortness of breath. Difficulty breathing, especially during physical activity. 2. Moderate exposure, dizziness, a feeling of lightheadedness or unsteadiness, weakness, general fatigue and lack of energy, chest pain, discomfort or pain in the chest area. 3. Severe exposure, loss of consciousness, fainting or inability to stay awake, confusion, difficulty thinking clearly or making decisions, blurred vision, impaired eyesight or seeing spots. 4. Delayed symptoms. After initial recovery from CO exposure, some individuals may experience delayed neurological symptoms, including memory loss, personality changes, and movement problems. Conclusion: recognizing the symptoms of carbon monoxide exposure is vital for prompt treatment and prevention of serious health consequences. Regular maintenance of fuel-burning appliances and installation of CO detectors can help prevent CO poisoning in homes. If you experience any symptoms associated with CO exposure, act quickly to ensure safety. Section 1 of an SDS is identification. This includes the product identifier, manufacturer or distributor, address, contact, and emergency phone numbers, recommended use and restrictions on use. Section 2 will discuss the hazards. Section 3 will discuss ingredients. Section 4 will discuss first aid measures. Section 8 will discuss overall exposure controls and best ways to protect yourself while handling. SDS contains one or more hazard ratings, which are numbers or letters that indicate the type or severity of the hazard. For example, flammable liquids are categorized from 1 to 4, with 1 being the most flammable and 4 the least flammable. Self-reactives and organic peroxides are categorized by type A through G, with A being the least stable and G being the most stable. Acute toxicity is categorized from 1 to 5, with 1 being most acutely toxic and 5 being relatively low acute toxicity. The hazard category does not appear on the label. You can only find it by consulting the SDS. The label will show the correct pictogram, signal words, and other hazard information appropriate to the chemical's hazard category. This pictogram indicates a long-term or chronic hazard, such as a carcinogen, mutagen, or chemical that makes it difficult to breathe. A flame symbol represents flammable chemicals. An exclamation mark represents an irritant, skin sensitizer, or chemical with narcotic effects. An exploding bomb stands for an explosive material or organic peroxide. A vial being poured onto a hand and metal bar indicates a corrosive material. A gas cylinder stands for gases under pressure. The pictogram showing a decaying tree and fish represents environmental toxicity. A picture of a skull and crossbones represents acute or short-term toxicity. Now that you have completed this course, you should be able to recognize the purpose and requirements of a HAZCOM program in identifying chemical hazards and their controls in your workplace. You should also be able to identify sources of information for workplace chemical hazards and requirements. This completes the HAZCOM training. Thank you.